Hello, everybody. Welcome back to Emergency Medicine Quest, where we're covering venomous injuries. So, in this part 2, we have to cover arthropods. Remember, arthropods will either have one of the three mechanisms. So, they either sting, they either bite, or they secrete venom through their pore or hair. So, the first category that we're going to discuss is Hymenoptera. This includes bees, wasps, hornets, ants. So the thing about bees, yeah, they will sting you and that pulls the stinger out from the bee and kills it instantaneously. But wasps, on the other hand, they have unbarbed stinger that does not that causes damage to the victim but does not kill the wasp in itself. The signs and symptoms of Hymenoptera bites are quite variable, varies with the degree, the type, location of envenomation, as well as the patient characteristics. So if a patient is, for example, stung in the tongue or throat, then that can compromise the airway. The most common scene is pain at the site of the sting with some swelling, redness, itchiness, but it can go to as bad as patient developing urticaria, wheezing, coma, and respiratory arrest. So we have again two lines of management. One is the out of hospital care or pre-hospital care, in which case we can give some ice bags to be applied at the site, which is going to relieve some of the pain and swelling. Epinephrine can be given in concentration of 1 is to 1000. Sometimes they come in the first aid kits. In the ED, we are going to manage this patient by their ABCs. Although there is no specific antivenom that can be given in these cases, wound examination should be done. So if there's one sting and some sort of a local reaction and the venom apparatus is still at the site of the sting, then it can be removed. Again, we can give these patients 1 is to 10,000 epinephrine if they develop any anaphylaxis. But be mindful that those taking beta blockers may not respond to epinephrine. In such cases, glucagon can be given 1, so glucagon 1 to 2 milligram. Arachnida is the other class that involves spiders and scorpions and ticks. So let's first start by discussing about black widow spider. It is a well-known venomous spider in which the females are mostly the ones that envenomate. As you can see, they are grossly black and then they've got some red strips. The way its toxin works is by destabilizing the neuronal membranes by opening ionic channels, causing depletion of acetylcholine from presynaptic nerve terminals. Patients who are bitten by black widow spider present initially with pinprick sensation and some local swelling and redness, but over 15 minutes to an hour they can develop dull crampy pain. Now if they got bit at upper extremity, then this dull crampy pain is going to concentrate in the chest, and if they got bit in the lower extremity, then it's going to concentrate in the abdomen. And it is generally noted that children are worse affected. So if the same bite causes pain in adults, can lead to cardiac and respiratory arrest in children. So as for the management, it remains the same. We have to keep an eye out for the ABCs. We can give some ice packs. Mostly the symptoms subside in 8 to 12 hours, but muscular cramps can be managed by diazepam. In certain pediatric population, elderly population, and pregnant population, we can consider giving antivenom. So it's called Latroductus antivenom. And its dosing is basically one vial diluted in 50 ml of normal saline, and it's given over the period of 15 minutes. Brown recluse spiders are also pretty toxic to humans. The most distinguishing mark of a brown recluse spider is this violin-shaped darker area on the cephalothorax. Signs and symptoms wise, some burning pain can happen at the site of the bite, but by 3-4 hours there will be a whitish area of vasoconstriction around the bite. Sometimes bleb can form, and eventually there can be some erythema around the bite, and lesion can basically resemble a bullseye. In cases of severe envenomation, there can be hemolysis, thrombocytopenia, shock, jaundice, renal failure, hemorrhage, and pulmonary edema. Mind you, the bullseye lesion takes a couple of days to fully develop. So management wise, we are going to stick to our ABCs, and we are basically going to look out for any signs and symptoms of systemic manifestations or toxicity. If they develop, then we have to monitor the vitals and urine output very closely. Previously, dapsone was given, but it's no longer recommended as it can cause methemoglobinemia and hemolysis, and there is no specific management for brown recluse spider. So disposition wise, we only need to monitor the patient for any signs and symptoms of toxicity. So scorpions have a tail-like structure, which is actually its abdomen. And if we notice, its last segment, also called telson, is the place of venom glands and its stinger. Signs and symptoms of scorpions include severe and immediate pain at the site of the sting, plus some local numbness and weakness. You can actually diagnose a scorpion's sting by tapping on the site of the sting, and if it causes increased pain, then that is significant. Systemic symptoms include anxiety, restlessness, muscle spasm, nausea, vomiting, excess salivation, sweating, itching, blurring of vision, so on and so forth. Management wise, it remains the same. ABCs: put an ice pack for some pain relief. Epinephrine can be given 1 is to 1000 to prevent any allergic reaction before we give antivenom. So the candidates for antivenom are severe envenomation, and normally these patients can be discharged for can be observed for 24 hours before they get discharged. Venomous marine animals are divided into three main classes according to the venom delivery. So there's bites, there's nematocysts, and there are stingers. Bites are mostly inflicted by octopus. So we see that it has a modified salivary gland that secretes the venom, and treatment is mostly supportive as there is no anti-venom. In nematocysts, it includes jellyfish, corals, sea wasps. Its mechanism of action is this spring-loaded venom gland. Interestingly, they can function even when they're dead or if their limb is severed. Its venom is antigenic and allergic reactions are often noted, and the severity of its envenomation is directly proportional to the number of nematocysts discharged and the toxicity of the species itself. Stingers include sea urchin, starfish, catfish, lionfish, zebrafish. If we talk about management of each of these, so as we mentioned, bites, it is supportive. There is no antivenom present. Management of nematocysts, so we have to remove the nematocyst. We have to manage the allergic reaction. Pouring hot vinegar over the place where nematocyst was lodged is often helpful. Management of stingers is mostly supportive, so you just remove the sting apparatus. You do the basic wound care, which is making sure that tetanus is up to date and antibiotics if needed. And this brings us to the end of venomous injuries.